Can anal sex cause hemorrhoids?
I wouldn't say they can cause hemorrhoids, but they can traumatize hemorrhoids that already exist. So if you do have hemorrhoids, maybe they're asymptomatic hemorrhoids that are there, and then having anal sex, that friction, that pressure, that can certainly make things worse.
Oh, so you can have like sleepy hemorrhoids.
Yeah, absolutely. Especially those internal hemorrhoids that are sleeping until something makes them bleed.
Nothing like anal sex to wake them up.
Exactly.
What about regular sex? Can sex cause hemorrhoids?
It can, again, exacerbate anything in that region. So anything that's causing increased pressure in that area, it could potentially exacerbate hemorrhoids. I don't want anyone to be deterred from having sex because of the fear of hemorrhoids, though.
Is there anything people should or shouldn't do if they're sexually active and they have hemorrhoids?
I think if you're having a flare-up, maybe best to stay away from butt play, but otherwise, I think people should feel comfortable doing whatever they feel like during sex.
As long as they don't mind getting maybe their cream on their partner's genitalia.
Yes.
So have any of your patients asked you about a correlation between sex and hemorrhoids?
I've never had a patient ask about sex and hemorrhoids, but I have a lot of people on social media ask about sex and hemorrhoids.
Yeah, I'm sure a lot sliding into your DM about that.
Yeah, are you sure that that's what they're DMing you about?
So I only look at the comments.
You only look at the comments.
Public comments.
Got it. So anybody watching this, if you DM SoCal Gastro Doc on Instagram or TikTok and ask about your sex behavior and your hemorrhoids, don't be disappointed if you don't get a response. It's not you, it's not your question. It's that Wendy mostly takes a broader survey through her comment section on her social media.
I get too many DMs and it's one-on-one, and I don't give out medical advice over social media. I'm not allowed to. But if it's education through the comments where other people can learn, I'm happy to answer questions there.
Like a classroom setting.
Exactly. The TikTok classroom.
The TikTok class. I'm in a lot of TikTok classes.
Yeah, you're getting your graduate degree.
PhD.
PhD at
TikTok University.
TikTok U, yeah.
You know what? It comes in handy every now and then. So it's safe to say, with all that we've learned about sex and hemorrhoids, is sex toys actually can only irritate hemorrhoids if they're increasingly causing more pressure on the anus.
I think pressure in the vaginal area can cause increased pelvic pressure, so that potentially, especially if you're a little rough, you already have an irritated hemorrhoid, could play into hand as well.
We'll let everyone's imagination go from there.
But just to be clear, a cock ring is not going to exacerbate my hemorrhoids.
Not your hemorrhoid.
Yes! And not my cock ring. Good to know.
I don't know how that could, not your cock ring cannot exacerbate your hemorrhoids.
You never know, right?
Whose cock ring are you playing with?
My cock ring. Not borrowing the neighbors.
What do you actually do when someone comes in with a butt problem? What's the experience? Is it similar to a gyno? Do they get into stirrups? Are they laying face down? Walk me through how that works.
Usually what happens is someone comes into my office, they're dressed in their clothes, nobody's taking off any clothes yet. So we sit in the office and we just have a conversation. I ask them about their issue, we talk about it, and then I'll let them know, okay, I would like to do an exam. Firstly, it's always your choice. I've had patients where I've told them I'd like to do, I call it a rectal exam. Some people say,
do you do this? I'd like to do a rectal exam.
No, because I would never have any patients come back and see me.
I imagine.
But I explain to them, I would like to do a rectal exam. Do you consent to it? So I think consent is a really important part.
Yeah.
And I've had patients who have told me, no, I don't feel comfortable, not today. And then I'm saying, that's fine.
And that's okay.
And that's okay. And I want to empower people that if you don't feel comfortable with an exam, just say so.
Yeah.
And if your doctor gives you a hard time, then that's not the right doctor for you. Find a different doctor.
I think this has also shown us that you can cover so much ground of knowledge and symptom sharing just through conversation.
Absolutely.
Instead of having to use the body until it's probably necessary.
Yeah. I mean, I think an exam is always helpful, but not if it makes you feel uncomfortable. So you've consented for the exam, and then I tell them, this is the exam table. So you're laying on your side as if you're getting a colonoscopy.
The only difference is you're laying on your side for all of 10 seconds when you're getting a colonoscopy before you fall asleep and then you wake up in another room.
That's true. You are awake during your rectal exam. We don't sedate people for that.
And we're not trying to sugarcoat this.
I have them lay on their side. We drape a sheet or something covering them, and then I tell them, lower your shorts and underwear, your jeans and underwear. I put on gloves, and I tell them, first, I'm just looking. And I take a look at that area, and then I let them know, okay, I'm going to feel around that area, and I'm feeling around the external area. And then I say, okay, I'm going to put in a finger to feel around that area. And then depending on what their issue is, I may be having them do certain maneuvers to
Make
test.
sure there's no surprises.
Please clarify maneuvers.
Right. So sometimes I have people push down as if they're having a bowel movement. Sometimes I have them squeeze. And this is all to check their muscles in their pelvic region.
What about coughing?
And sometimes coughing, yeah. So bearing down, coughing, those
Yeah.
are kind of the same.
You'd mentioned that you start kind of the medical version of foreplay, a little bit of around the area, and then you might penetrate lightly into the anus in order to inspect what's going on there. Is that painful for the patient? Do you use lubricant? Do you put on some jazz? What do you do to kind of ease that experience for somebody who's not used to having foreign objects in that orifice?
So no jazz. but
No
we
jazz.
We do use lubricant. And then I think a lot of it's just walking them through what is an
Right.
uncomfortable experience, but understanding, I try to keep it as brief, but do a good exam at the same
And
time.
a lot of communication. Obviously,
Exactly.
sounds like it helps them
Yeah,
feel
and like
a lot more
forewarning,
comfortable.
like
Yeah.
I'm going to look. Now you're going to feel this.
Yeah, no surprises.
Exactly. And then after I've done that exam, sometimes depending on what they're in for, we can do an anoscopy, which is I wish I had brought an anoscope here. It's sort of like a similar device to when you get a pap smear.
Oh, the duck.
Exactly. So we go, it doesn't open up, but it goes in and kind of helps you visualize. There's like a little light inside.
And that might allow you to see polyps or hemorrhoids
Polyps, hemorrhoids, exactly.
or a fistula, perhaps.
Yes, exactly.
I'd imagine that a lot of people are scared or maybe feel awkward. How often after the examination do your patients tell you, oh, that was no big deal?
I don't know if anyone has said that for that particular exam. I hear that more commonly with colonoscopies.
With colonoscopy.
Yeah, there's
Right.
probably a lot of hesitation and anxiety of like not knowing uncomfortable
Exactly.
procedure
Right.
and then being like,
Exactly.
oh, I'm fine.
Yeah.
What can we do, I think, collectively to make people more comfortable with seeking the level of either care or advice from medical professionals that they should, depending, of course, on the severity of their symptoms?
I think just educating people, having a conversation like this, letting people know that these things exist. Like hopefully this conversation here is going to give someone a mental preparation for what's going to happen when they go see their doctor about their hemorrhoid. Like just that preparation, anticipation, education.
What kind of doctor should I go to if I suspect that I might have a hemorrhoid or another issue in that region?
So the two specialists you can see is either a gastroenterologist like myself or a colorectal surgeon. I think those are the two types of doctors that would have the most experiencing in diagnosing and treating conditions in that area.
If I have a GP or a general practitioner, doctor, a family doctor, or otherwise, is it okay for me to go to that doctor? And generally, what do GPs do if they suspect that there is something that requires medical attention? How does that process work?
Yeah, so absolutely, your family medicine doctor, your primary care doctor can diagnose and do the initial diagnosis and treatment. And so they will do an exam similar to what I described, so the rectal exam. Some primary care doctors are more comfortable with that than others, just depending on their patient population, what their experience level is there. And so sometimes they might refer you to a specialist, but that's always a good starting point.